So there is no doubt surging case numbers linked to students aren't isolated to campus. UW-Madison is intertwined with the downtown area, leading to a warning from the Public Health Department today.
Our Gabriella Beccari joins us live from downtown Madison to explain what that warning, which came via Twitter, actually means for people who've been in that area the last 2 weeks. Gabby?
Charlotte and Eric, that tweet is causing people who have been downtown recently to question if they could have the coronavirus. But a local health expert says while those case numbers are concerning, there's no reason to panic just yet.
Elise O'Brien has been careful all summer, assuming she could get the coronavirus anywhere.
For me, the personal, like the habits, everything I've been doing, not really changing too much. Just want to be cautious all the time.
But Public Health's message focusing on people who've been downtown recently did confuse her co-worker, Lizbeth Huertas. She wondered what this means for her other responsibilities.
I'm still expected to go to my in-person lectures, even though now I have to assume that I've already been exposed. So am I right to assume that I'm exposing everybody in my lecture of 100 people?
But Dr. Nasia Safdar with UW Health says simply living or working downtown isn't reason enough to go get tested.
Well, I think there's two situations where you would want to get tested. One is certainly if you get symptoms, even mild symptoms. And the other is if public health, through their tracing, identifies that you have been exposed to the point where you need to get tested.
Safdar explains community spread happens through large droplets and contact, which is why wearing masks and physical distancing is so important.
Nothing is 100%, which is why removing the social gatherings and non-essential activities is still very important.
Both girls say they'll continue to be careful in hopes of keeping their friends and family safe.
Stay in my room whenever I can. We don't share food. We try and just do our own thing and sit far apart and do that. But it's a little stressful to have to think about, I want to be courteous of the people I live with.
Dr. Safdar says if you have any symptoms, it's worth getting tested. But some of the more distinguishing symptoms are fever, cough, sore throat, muscle aches, chest tightness. And if you get a negative test, that doesn't mean you have a free pass to not be careful.